Heart attack is the most devastating illness which can take life away in seconds. Approximately 15% of the young persons had heart attacks.
Does the chest pain, do we call it, is it a signal of every heart attack?
Every chest pain is not heart attack.
Fastest treatment for ACS.
Acute coronary syndrome, first and foremost important thing is to not delay the diagnosis. किसी को अगर हार्ट अटैक आता है तो 30 दिन पे, 6 महीने पे और 1 साल पे डेथ होने की प्रोबेबिलिटी होती है. वेदर एंजियोप्लास्टी और बाईपास, विच इज बेस्ट फॉर द पेशेंट. कॉलेज, जॉब, एवरीवेयर द स्ट्रेस.
Every 33 seconds, someone in the world has a heart attack. But what if we could detect it earlier, prevent it, and reverse the risk? Today at Madhvvi Acharya, we have a renowned cardiologist, Dr. Sandarbh Patel, at our show. So, welcome, Dr. Sandarbh Patel, to our show.
Thank you, Madhvi. Thank you very much. I am Dr. Sandarbh Patel, Interventional Cardiologist. I am practicing at Jivraj Mehta Hospital. Right now, we are sitting at my OPD clinic, Aaradhya Heart Care. Interventional cardiology has been my passion since my MBBS days, because heart attack is the most devastating illness which can take life away in seconds.
Right.
So if I can halt or prevent heart attack and cure the heart attack patients, that gives me the utmost satisfaction. But this is about my clinical practice part. Apart from that, our basic job and my passion is to disseminate the knowledge about heart attack to general population, so I can help them prevent heart attack whenever, whichever way possible.
Right, right. So, Dr. Patel, thank you for opening your doors for us and giving us an opportunity to to organize a podcast for you. Let's begin with the basics. What exactly is acute coronary syndrome, and what should every young people should take care about it?
Yeah, this is a very good question, and the best part of this question I find is young people. Because previously, like last 1 or 2 decades, approximately 15% of the young persons in Western country or India or Southeast Asia had heart attacks. What is young? Generally, we define as less than 45 years age as young for having heart attack.
So until 45 years of age, you said that it's young, but what is the age we begin with that young?
Anything below 45 is young. Generally, there are certain disorders where cholesterol or what we call lipid या फिर जिसको चर्बी बोलते हैं, so उसके कुछ आनुवंशिक genetic diseases are there.
Right.
In that, patient may get heart attack as young as age of 10 years, 12 years. But if we put it aside, if there is no specific genetic disorder,
Right.
even apart from that, in say last 5 to 10 years, we have seen of getting heart attack to patients as young as 21 years, 24 years. Last month, I treated a patient, young patient with heart attack who was 27 years old.
Right.
He was very lucky that with my initial treatment, his clot dissolved in such a way that he didn't require angioplasty.
Okay.
We see not just below 45, like 40 years or 35, we see as young, early or as young as 25 years age patients also having heart attack nowadays.
Right.
And so what I was trying to say is that previously the statistics were around 15% for below 45 years of total number of heart attack patients.
Right.
But lately we have seen in certain study and data like government institutes and all, that percentage has been rising up to 20 to 25% also having young
Right.
heart attack. So that rising percentage of young patient having heart attack is very alarming.
Right. So, sir, I would like to clarify, as per the audience in general, people, there is a misconception. So, does the chest pain, do we call it, is it a signal of every heart attack?
So it is in one line if we say that every chest pain is not heart attack,
Right.
but chest pain could potentially be of heart attack, and no other disease which causes chest pain can be as lethal as heart attack.
Okay.
So whenever someone has chest pain, he should, or his first primary contact doctor should have it back of mind that this could be heart attack, because
Right.
chest pain can be due to muscle issues like chest wall muscles, or even in females breast muscle, etc. can have chest pain.
Right.
Ribs, bone can have chest pain. Chest pain can be due to lungs or due to acidity, stomach, esophagus, जिसको हम अन्न नली बोलते हैं, swallowing difficulty, इन सब की वजह से भी chest pain हो सकता है, पर इनमें से किसी में जान जाने की संभावना नहीं है.
Right.
हार्ट अटैक के भी हर एक पेशेंट को जान चली जाती है ऐसा नहीं है, बट देयर इज अ पोटेंशियल.
Correct.
So
Right.
that should be an important focus. And as you said, what is acute coronary syndrome? तो उसको सिंपल लैंग्वेज में, लोगों की लैंग्वेज में हार्ट अटैक बोलते हैं.
Right.
So every organ in body requires blood supply.
Okay.
Without that, nutrition doesn't go. So
Correct.
heart is a pump which pumps blood to all parts of body, but to function, for this pumping function, it also requires itself blood supply.
Right.
So there are three main blood vessels which provide blood supply to heart. Now for some or the other reason, like cholesterol deposition or blood clot formation, if those
Right.
arteries get blocked, these are the pipes which supply
Right.
blood to the heart, if they get
Correct.
blocked, they get clogged, then the muscles which they supply, their blood supply is interrupted.
Correct.
And those muscles, in simple language, starts dying. They don't immediately die, but they starts dying. They may die within 10 minutes or they may die within 6 hours or 12 hours. So that dying of heart muscles, it gives intense pain signal. Body has a mechanism
Right.
that depending on the vitality of the organ, when it gets affected, they give the signal. So the affection of heart muscles gives the pain. That
Right.
starting of pain indicates that heart attack has started.
So why do we call it a syndrome, not just a heart attack? Why do we specifically call that?
Yeah. So acute coronary syndrome, the word syndrome is there, it's a medical terminology.
Right.
For laymen, common people, we simply define it as heart attack, but it has various aspects. Like acute coronary syndrome has mainly three aspects. There is one is unstable angina, second is non-ST elevation MI, and third is ST elevation MI. So ST elevation MI is one of the worst. In simple language, this is a massive heart attack, where in basic tool to know there is heart problem is ECG, electrocardiogram, छाती की पट्टी जो बोलते हैं वो.
हाँ जी.
So in that ECG there are ST elevation, that means massive or major heart attack. Then second is NST-MI, that is non-ST elevation MI, where there are no elevations, but in our language we call it ST depression. So if with ST depression there is one blood report, we call it troponin. If it is abnormal, then that is called minor heart attack. So that is second aspect of the syndrome.
Right.
And third aspect is unstable angina, where ECG minor abnormality is there, but troponin is normal. But still, we as a clinician get an idea that this patient has potential blockage, but it has still not developed even minor attack. So it's a good candidate where even before attack has happened, we can act. So
Right.
basically these three types of diseases are included in acute coronary syndrome.
Understood. So, sir, what are those the early signs which generally people tend to ignore for the blockages?
So generally in our textbooks and in our knowledge and in our guidelines, there are potentially 4 symptoms which could be related to heart and could be related to developing blockage in the heart vessel.
Right.
First and foremost and main is chest pain, छाती में दर्द होना. Other is breathlessness, सांस फूलना.
Right.
Third is fatigue, मतलब दर्द भी नहीं होता, सांस भी नहीं फूलती, पर थक जाता हूँ. And fourth is palpitation, मतलब धड़कन फास्ट चल रही है या धड़कन फील हो रही हो. So
Right.
chest pain, breathlessness, fatigue and palpitation. All 4 symptoms could be early sign of developing blockage. So what generally happens that if a person is working somewhere in his job or has a habit of doing exercise, so previously he normally or easily can do 1 hour of exercise or do his daily job or walking this that. Now he gets either this pain or breathlessness or fatigue or palpitation at 80% of his normal capacity.
Okay.
So that is the early sign. थोड़ी capacity कम होने लगी. Then this capacity starts decreasing. Like अभी 50% work पे ही हो जाता है. And then in later stages, if those early signs are ignored, then कि ये रूम से उठ के बाहर जाता हूँ तो भी सांस चढ़ जाती है, भारीपन फील होता है. So these are the early signs of that there is some problem in the heart, some blockage is developing.
Right. So, sir, if we talk about in general the genetics versus the lifestyle, so how much is the probability for genetics or the unhealthy lifestyle people are maintaining to come across this heart attack or a chest pain issue?
Both of them are important. Either of them could individually be also cause of heart attack. but
Right.
both are mutually agonistic. It's like कि बारूद पड़ा है और चिंगारी कैसे लगेगी. So this बारूद
Right.
many a times is the genetic predisposition, and bad lifestyle is the igniting factor. Proportion varies in individual persons. Many a times what we get is like that. I just mentioned last month I did treat a 27-year gentleman.
Right.
He didn't have any like heart attack has risk factors
Right.
like blood pressure, diabetes, smoking, tobacco, usage of lifestyle. So smoking, tobacco is a lifestyle problem.
Alcohol.
Alcohol in certain type of heart disease, it is also a risk factor. Sedentary lifestyle, lack of physical activity, and bad dietary habits, all these are risk factors, but that gentleman didn't have any risk factors. So what would have caused at 27 years? So most likely his genetic risk was very strong. He had history of heart attack to his father and uncle at a very young age, below 45 years. So in certain patients, genetics is the only factor. In certain patients, genetics will always be in the background, but bad lifestyle is a culprit factor. But many a times in younger patients where other factors have not had enough time to act, in those genetic is the main factor which is culprit.
Right. So, sir, if we have to talk about the fastest treatment for ACS.
Acute coronary syndrome, first and foremost important thing is to not delay the diagnosis. So whenever there is a chest pain which is not relieved within certain time limit or by certain जिसको बोलते हैं ना घरेलू उपचार वगैरह से, immediately contact your doctor. May it be general practitioner or physician, or best if you go to the cardiologist. We do the ECG and echo and the blood report troponin. We just diagnose that this guy has or the lady has acute coronary syndrome. First and foremost we do is we give him blood thinning agents, tablets. We call it loading of antiplatelet medicine. So normally the dose is 75 milligram. So we initially give 300 milligram of two blood thinning agents and atorvastatin. It is a cholesterol lowering drug, but there have been massive large data that giving high dose of statin at the start of acute coronary syndrome, at the start of heart attack, helps very much in reducing the 30-day mortality. Like किसी को अगर हार्ट अटैक आता है तो 30 दिन पे, 6 महीने पे और 1 साल पे डेथ होने की प्रोबेबिलिटी होती है. तो ये जो लोडिंग होता है वो प्रोबेबिलिटी को बहुत कम कर देता है. फर्स्ट एंड फॉरमोस्ट इज दैट टैबलेट्स, देन वी गिव ब्लड थिनिंग इंजेक्शंस. सो ये 3-4 चीज़ अगर दे दिया तो भी हार्ट अटैक हॉल्ट हो सकता है, उसका प्रोग्रेस स्लो हो सकता है और आगे की जो ट्रीटमेंट है उसके लिए बढ़िया से बेस क्रिएट होता है.
Correct.
This is again a very good question. Like we say, time is heart and time is brain. So time is the foremost important thing. सब acute coronary syndrome में जल्दी से जल्दी निदान यानी डायग्नोस होना ये सबसे इम्पोर्टेंट चीज़ है. सो टाइम शुड नॉट बी वेस्टेड. अगर कोई भी चेस्ट पेन है जो थोड़ी देर में रिलीव नहीं हो रहा है या घरेलू उपचार से रिलीव नहीं हो रहा है, इमीडिएटली कॉन्टेक्ट योर फिजिशियन और बेस्ट इज कार्डियोलॉजिस्ट. नाउ व्हेन वी सी दैट इट इज एक्यूट कोरोनरी सिंड्रोम, वी गिव लोडिंग एंटीप्लेटलेट, मतलब खून पतला करने की गोली का हैवी डोज देते हैं, कोलेस्ट्रॉल लोअरिंग ड्रग का भी हैवी डोज देते हैं, प्लस खून पतला करने का इंजेक्शन लाइक हिपेरिन या क्लेक्सेन. We give intravenous dosage of those injections. What they do is they make the base for our further action like angiography, angioplasty or bypass, as well as by giving this loading treatment, 30 days, 6 months and 1 year outcome improves. Death होने की जो संभावना है उसको ये कम करता है, एंड ऑल्सो जो अपने एंजियोप्लास्टी बाईपास करते हैं उसका रिस्पॉन्स जो मिलना चाहिए उसको ये बेस्ट बनाता है. एंड व्हाट दीज ड्रग्स डू इज that they prevent further clot formation inside heart vessel, as well as they at times dissolve some of the clot.
Right. So, sir, for example, post these diagnoses in case, how do you make that decision that this person's stunt is sufficient for this person? Because bypass, I guess, is more risky compared to the stunt. So, how do you differentiate from the ECG report or echo which you do?
Yeah. So whenever the patient has a chest pain and we suspect that acute coronary syndrome, so basic ECG, echo, blood reports, they give us the confirmation of diagnosis.
Right.
Then we now need to know, we clinically know that blockage is there.
Right.
And 95% of time we are correct. We can say from all this investigation that among the 3 vessels, whether LAD is blocked, circumflex is blocked or RCA is blocked.
Right.
So we need to confirm it, and best and only way to confirm in a heart attack patient is angiography.
Right.
Angiography is the diagnostic test. Just a diagnostic test, निदान है. It is not a treatment. Many a times हम पेशेंट को बोलते हैं, रिलेटिव को बोलते हैं एंजियोग्राफी करना है, तो वो घबरा जाते हैं कि ये ऑपरेशन हमें नहीं करवाना है. जस्ट टुडे इन द मॉर्निंग इट हैपेंड लाइक दैट. सो देन वी पेशेंटली एक्सप्लेन देम. सो एंजियोग्राफी इज जस्ट अ डायग्नोस्टिक टेस्ट where we put a pipe inside the hand or in the groin which goes to heart. We give a dye and see it on the X-ray cine images,
Right.
Which vessel is blocked.
Blocked, correct.
So that is the diagnosis, that 1, 2 or more vessels are blocked. Then there are like when you said why we call it a syndrome, then I said there are 3 parts.
Right.
So like blockage has so many characteristics, how long, how the artery is wavy or not, only cholesterol is there or calcium is also there, multiple blockage is there. Along with multiple blockage, heart pumping is less or not. So there are multiple criteria. There are various scoring systems which help us in defining how critical and which type of blockage. One famous scoring system is syntax score.
Okay.
Where if score is below 23 up to 32 or up beyond 32 and 45 or something. So if higher is the score, then it is a suitable case for bypass. If middle level is there, both options are there, and if score is lower, and then we can treat it by angioplasty.
Right.
But again, whether angioplasty or bypass, which is best for the patient, it is a multifactorial decision making. Sometimes I as a cardiologist in emergency decide it, and sometimes we do a heart team approach, like me as a cardiologist, cardiac surgeon who does the bypass,
Right.
and cardiac anesthetist. We all sit together, discuss the case,
Right.
call the relatives, discuss with them, and decide it as a heart team approach.
Even there is a lot of people feel that women cannot have a heart attack. So how do you address this? And in case if a women or a male is undergoing a stunt process, what is a prevention and taken care things we have to work
So
on?
let me address the second part first. Generally, our conventional knowledge has been, which is very true also in our learning, that women who are menstruating, like before menopause, the hormones which are involved in this cycle, menstrual cycle, they offer certain degree of protection to women from heart attack, which stands true today also.
Right.
But as I said, below 45 years, heart attacks are increasing a lot. They are more increasing men.
Correct.
But women also nowadays we see more often below 45 years age or before they are approaching menopause, who are having heart attack and heart blockages compared to what we used to see previously.
Previously, right.
So if we see 10 young heart attack patients, then 2-3 women are there among them also. And previously that percentage was much low. Whoever had young heart attack, majority of them were men. Now women are entering that bad club also. So it is not like that ki women nowadays can't have young age heart attacks. So any chest pain in women also has to be considered a heart problem. And particularly the 4 symptoms previously I said could be due to heart. So again, chest pain could be of different type in male or female.
Right.
Someone would have central pain, someone would have pain just over the heart, which is in the left side of the central part. Left shoulder, left arm, left forearm, medial aspect of left forearm, that pain could be due to heart. Up to right shoulder could be due to heart. Right arm is not generally due to heart.
Right.
Front of the chest, back of the chest, jaws pain or could be due to heart. In particular in female women, they feel a choking sensation in the throat or the jaw pain. They may not have the classical chest pain. So all this could be due to heart.
Right.
So even when classically lady comes to us that she has a choking sensation when she walks or a jaw pain, we consider as an early sign of heart attack also. So to keep in mind that women could have a little different kind of pain due to heart attack is also an important thing.
Right.
And aftercare. So once we have diagnosed ACS, angiography is done, angioplasty is done. Good thing about angioplasty is that recovery is speedier in terms of that chest wall has not been opened. So 1-2 month rest like that is required in bypass is not there. If we have done it from groin, then we make the patient move next day in our ICU or wards. If we have done from hand, we allow the movement on same evening or next day early morning.
Right.
So 1 or 2 days when patient is in ICU, we allow them to do gradual mobilization, chair sitting, going to the bathroom, etc.
Right.
And then generally after discharge, I have a standard protocol of calling my heart attack patients at 7 days, then 1 month, then 3 months or so.
Right.
So till first follow-up, we ask them to take overall rest, but not bedridden.
Right.
Allowed to go to washroom and moving from one room to other room. At first follow-up, we do the basic assessment like repeat ECG, echo, blood test if necessary, some treatment changes, and then allow them to resume their routine activity gradually, like morning, evening walks, and resuming the job, depending on severity of heart attack. If someone had very severe heart attack and pumping was less or pumping is still less at follow-up, the resumption of activity is little gradual. धीरे धीरे जॉब या तो चलना शुरू करना है. So हार्ट अटैक के बाद स्टेंट रखने के बाद कैसे एक्टिविटी जॉब वगैरह रिज्यूम करना है वो इंडिविजुअल केस टू केस वेरी करता है, पर कंपेयर टू बाईपास काफ़ी अर्ली रिजम्पशन ऑफ नॉर्मल एक्टिविटी होता है. एंड बाय द फर्स्ट मंथ फॉलोअप, generally I allow my patients to do travel by car or train or even air flights, etc. Everything is allowed, and beyond certain time period they do all sports activity and everything.
Okay.
1 or 2 of my patients are doctors.
Okay.
So 1 or 2 doctor friends who have undergone angioplasty by me in less than 1 year duration. We play twice a week 1 hour of pickleball, which is quite a good high intensity exercise. So after angioplasty you can enjoy all your normal activities and high intensity sports also.
Understood. So just to add on the question, as you stated about for women, that as you address, even these days women are facing the heart attack. So is it because of the lifestyle, or is it because of the lifestyle in terms of work pressure, because a lot of women are working professional, or is it because they are now, even women are into alcohol, smoke, partying late until early morning? Is it because of that one of the cause? Genetic, of course, genetic is something, it goes by default, but
which you cannot change.
Which we cannot change, precisely. So when it's come to, apart from this, what is the main reason that women these days, which earlier, which never used to happen, but these days women are facing this issue of a heart attack?
So in our previous few questions, I explained that there are certain risk factors for heart attack. So those are very commonly or since old days known conventional risk factors like blood pressure and diabetes and habits, bad habits like smoking, tobacco and all. So apart from that, we are observing that certain unconventional or newer risk factors are there. One of the major risk factor is stress.
Correct.
Like in your or my childhood, what stress we had during school days. I used to play after my school at 5 p.m. I used to play for 2-3 hours, study for 2 hours. Next day comes, again go to school.
Right.
If you see our children, my children, or the younger generation of schooling, lot of stress in the school days, teenage, and then again in college, job, everywhere the stress which previous generation has faced, compared to that stress has increased. What stress does? Any kind of stress, physical work pressure and mental stress, particularly of job, of reaching the targets. In college people also there are certain type of stress.
Everybody
These days,
wants to become popular, right?
FOMO is there, fear of missing out, whether it is Garba or smartwatch or mobile or this or that. All these are kind of stress. They shrink the blood vessels. Stress inside blood vessel increases. So then this cholesterol lipid deposition increases. So stress is a major factor. Pollution is a major factor.
Right.
All this is not proven in large studies. You cannot ethically expose certain person to certain stress and pesticide pollution and compare them to others who do not have faced that. So, but there are observational studies which say that stress is a major factor, pollution, pesticides, and lifestyle is also important. Previously, maybe women were not having so much of bad habit like smoking. Then post-COVID, we have seen increase in number of heart attack. In peak COVID times, we saw that whoever had severe COVID, they had a higher chance of heart attack. And after vaccine also we used to see in certain patients clotting inside vessels. So I'm not someone to say that COVID and vaccine are causable.
Right.
We have just observed.
Right.
So there were studies in government institute, one of the largest government institute is in Ahmedabad. They had
Right.
studied all the young heart attack patients and what data they got, irrespective of whether the young men or women. What they observed was that bad lifestyle was a culprit. Bad lifestyle like staying awake till late night, less sleep hours, waking early. Then they had even observed the dietary variations. Like even if I'm taking good diet, but my timing is wrong, then
Right.
that is also one of the risk factor. Like if 12 noon or 8 p.m. earlier dinner and all. So if my lunch is late, dinner is delayed, that is a factor. And of course, fatty, oily food, fast food, junk food, those are the factors. So earlier heart attack in women has all these factors also, including bad lifestyle.
So this actually goes to our viewers. So thank you so much for sharing this beautiful insight, which is fruitful. So to our viewers, you really need to implement Aaj Mein Raho, Aaj Mein Jiyo, so that you can live healthy. So thank you, Dr. Patel, for our episode 1, that is acute coronary syndrome. Now stay tuned for our next episode.